people also tend to buy antibiotics over the counter and eat them indiscriminately. How would you advise people in this context, and what can be the implications and consequences of the same on the kidneys?
So, Sujata, an antibiotic course for 5 days or 7 days, when prescribed, normally would not harm the kidneys. But
Right.
suppose if you are a diabetic, and there are a lot of patients in our country who take the drugs across the counter, doctor has given one's prescription for something, they keep the prescription home, and next time when they are sick, they go to the chemist and buy the drug by themselves. Now, suppose I will give an example. Somebody is a diabetic and he has been given in the past ciprofloxacin for his urinary tract infection. Now, this is a very fine drug for a short-term use. But a diabetic with a kidney disease, when they take ciprofloxacin, their sugars can suddenly drop and they can have acute interstitial nephritis and rise in creatinine. Similarly, all the drugs like ceftazidime or amikacin or gentamicin injections, which are aminoglycosides by the group. Now, any
Mm.
patient who has even minimal kidney disease because of the diabetes or hypertension, and if they take these injections without checking their creatinine or without advice of a proper doctor, that creatinine can suddenly rise. So these are the issues with patients who are diabetic and hypertensive and those who already have underlying kidney disease. Now, patients, when they take certain safe drugs like doxycycline or ampicillin or amoxicillin, there is no issue if they take it for 5 to 10 days. But they should not repeat the same drugs without consulting doctors for the next illness. They should always check their diabetes status, their kidney status, and then consult a doctor and then start their antibiotics. So, oral antibiotics, except for ciprofloxacin, we are not worried much. But injectable antibiotics, which are given but in nursing homes or in family doctors' practice, when suppose somebody is a diarrhea, vomiting, the gentamicin, amikacin is freely given. And
Mm.
I would say that this is very dangerous and it can precipitate acute kidney failure on a basis of an existing kidney disease, and you can come in a big trouble. So antibiotic use across the counter should be avoided. You should consult your doctor before taking drugs, and all aminoglycosides, whether it is in family physician's office or a consultant's office or a nursing home or a hospital or in a critical care setting, should be used very judiciously to prevent the kidney damage.